This is a picture, okay, kind of a side view picture that if we cut a line down the middle and just kind of opened you up like a book, this is what we'd be looking like at the pelvis. So this is a side view of the bladder, this is a side view of the urethra, this is the upper part of the vaginal wall. You do not have this. This is cervix and uterus, okay, so this is gone. And then posteriorly, you have the posterior part of the vagina with the rectum behind it. Okay.
Yes.
What you have is where the cervix and uterus was. Okay. This portion of the vagina. So if you think of it like a U, so this portion up here has lost support and has fallen down. As it's fallen down, it's pulled the bladder with it. Okay, and so what's happened is if this is your urethra and this is your bladder, as this upper part is fallen down, it's pulling the bladder like this.
Oh.
Okay, so what that's doing is putting a kink in your urethra. Okay, your junction of your bladder and your urethra right there. Plus, you're urinating up, out, and around. Okay, as opposed to squeezing and coming straight out, you're having to go like this to get the urine out. So that's why the stream can be a problem. That's why the emptying can be a problem. That's why you can have urgency because everything's kind of fallen and things like that. And because you've lost support, that's part of the reason why you probably have some leakage. And the reason why you don't have a lot of leakage with coughing, laughing, sneezing is you have created this kink. Okay, now there are going to be times in the day when the amount of falling is worse than others because I'm examining you laying flat on your back with your legs up. Okay, you know, normal life, we're all standing up and everything, and so gravity is going to make things fall even more. And the tendency is at the end of the day, when the muscles are weak, when you're fatigued, the degree of falling tends to be worse as well. And so most women will notice kind of more issues, you know, afternoon, evening than they do like first thing when they just get up in the morning. And so that's a very common thing. Now, with that said, the good news in all of this is that you do empty fine. So there's nothing that medically you have to do about things, okay? If you don't like what I'm about to say, you don't have to do anything because you're not hurting yourself. You now know what the issue is for sure, and you just kind of live with it. Now, with that said, what are the options? Well, option number one is that you kind of lift up the bladder, re-support this portion of the vagina that's lost support from having the hysterectomy, and you re-support that to some ligaments in the pelvis, okay? And then you re-support the bladder that a lot of times just by pulling up the part of the U that's pulled down, we call that a traction cystocele, and then it kind of pulls the bladder with it. A lot of times just by re-supporting that helps out quite a bit. But if you're going to be in there, I would re-support the bladder just so you don't want that to weaken and fall as well, okay? So that's obviously a surgery. That surgery takes about 1.5 hours to 2 hours. I don't use any mesh products for that. I use a cow skin, which is a biological graft, okay? So there's no mesh or anything that's left in you that's permanent. The cow skin basically causes your body to react to it, and after about a few years, the cow skin is gone and just kind of replaced by your own tissue. So nothing that's foreign that stays forever. It basically is, you know, kind of taken care of by your body's, you know, immune system, and that's what kind of holds things up as far as the bladder goes. I also use some of that to attach it to the ligaments in the pelvis to hold the apex or where the uterus and cervix were, to hold that area up too. So kind of use that graft all inside there to hold everything up. Main risks of the surgery: risk of bleeding, rare to require blood transfusion, risk of infection. We give you antibiotics before and after. Worst case scenario of infection is the cow skin can get infected, but again, that's pretty unusual. Less than 1 in 1,000 have that happen, so it's a pretty unusual thing. risk that you still have the urgency. There's about a 70% chance that kind of the urgency and frequency goes away when you re-lift things up. About 95% chance leakage with coughing, laughing, sneezing, goes away, and then obviously the sensation of everything falling also goes away. Typically an overnight, hospital stay. Typically most women take about 2 or 3 weeks to kind of get back to feeling normal. No heavy lifting, no exercise, nothing strenuous for about 6 weeks after surgery. Okay, so that's kind of what's involved in a nutshell with surgery. Option number 2 is you could go back and I could re-refer you to gynecology and they could put something in called a pessary. Okay. So, but that's kind of what that is. But those are your options. Would be living with things, pessary versus surgery, and this becomes a quality of life issue. So you're the one that really decides how is this impacting the quality of my life. Is it impacting enough that I would want to go through a surgery? Is that something at 86 that some people get to certain points in their life and they say, I'm not ever doing surgery ever again, blah blah blah. Some people say that. Some people, I've done this surgery on 93-year-old women that are just like, quality of life isn't good, so got to do what I got to do to enjoy the life that I have left. So at this point, kind of up to you to decide where to go from here.
I have a couple of questions.
Certainly.
One is, what happened to the mesh that was up there?
Well, back when you had that, it wasn't a permanent mesh. It was more of, and I don't know the exact product then, it's going to be either human skin or pig skin, and there's some other things that were used back then, but mesh wasn't used at that time.
Oh.
So no mesh, but it was just some other form of graft that was there.
Oh, and
So
I had
that's
it twice.
probably gone. Probably all gone.
Does it just go out through the...
It just does. The
urine?
body eats it away.
Oh. Body eats it away.
Yeah.
Very strange.
Yeah, because it's not you, so your body is like having an infection. Your body reacts to it and takes care of it. But back when you had all this done, mesh was not being...
You don't remember that, do you?
I do not remember it, though.
Yeah.
And I don't have, so that means, it goes so far back that
Right.
it's
Did they keep that kind of stuff in the archives? I know that they don't keep it.
Yeah, they don't. They may have it in hospital archives.
Uh-huh.
We keep our stuff for about 7 years because that's what we
Yeah, I was
require.
told that.
Yeah, and beyond that, it's gone.
So I was wondering what your function was during this surgery.
Probably to support the bladder if there was some need of support.
Yeah.
But again, without seeing the actual.
Oh, I'm sure that's
Operative
what it
report.
was now that you mentioned
Yeah,
that.
without seeing the operative report, I don't know what I did because there's different things that I do based on what the issue is or was.
Very good. Very good explanation. And
What about the itching? Do you want to ask about that?
oh yeah,
Mm-hmm.
yeah. Isn't that the mucus that's around the bladder and stuff that's causing that?
No, what it is that the itching, the itching is due to loss of hormones, number one. Number two, it's due to internal tissue that's now almost on the outside of your body. Okay, what do I mean by that? Well, there's 2 areas of itching. So if you look at the opening, when I'm looking at the opening of the vagina, okay, you have something called labia, okay?
Yes.
On the labia, you're very, almost look like you have burn there. It's so red and kind of chapped, and the skin is, because it's just like skin, okay? Because it's on the outside, and that's typically from loss of hormones on the outside that you're having that problem, okay? So that's part of it. Number 2 is internally, okay? So, again, if you think of the vagina just simply like a U,
Yes.
okay? This is all on the inside of your body, okay?
Right.
This isn't skin on the outside that's used to being exposed to the elements and things like that. your bladder and everything comes down so much. My bet is that at the end of the day, with you standing, things like that, it's probably rubbing up against your clothes, okay? And that tissue is very sensitive normally. It's not thick like your skin that can deal with that. And so that's probably the other portion of the itching kind of sensation is you have tissue that's not used to being where it is. It's not meant to be there.
And the tissue is very thin, I know,
Very.
between the anus and the opening of the
Yeah, correct,
vagina.
correct. It's not always like that far.
Yeah. So,
would a Premarin cream help her?
So you can use a Premarin cream, an estrase cream, one of those things.
that's what I'm
She
using.
also needs to use it on the outside. Okay? Inside actually looked better than the outside. So I can tell that you're getting some use inside, but really on the outside, just on the border, so this is kind of the opening,
Right.
along both kind of sides, it looks, for lack of a better description, it kind of looks like a diaper rash type of thing that a baby gets, and that it's just tissue that's very red and inflamed, and that red and inflamed tissue typically gives you itching and burning and things like that as a usual thing. So part of using the cream is, you can use the cream internally, but you're going to have to use some on the outside to get some relief as well.
I do use it on the outside.
Okay. And outside of that, we, again, we have, a laser treatment here that we use for that kind of problem. It's not something that's covered by insurance, but it treats both the outside and the inside to help with the itching and the burning and things like that.
But there's no new method of raising all this stuff up where you can just go in there and pull it up with a thing.
You mean the bladder and everything? Yeah.
Yeah.
No, there's no newer
Pity.
thing. Yeah.
Maybe I'll invent
And there
something.
you go. You work on it. Okay.
Okay. You've been very helpful and
Okay.
informative.
Okay.
It's been a pleasure seeing you again.
Well, you let me know if you want to do anything more about things. You think
will.
about things.
I want to think about it.
And I don't expect, again, not that age is everything, but if you come here at age 50, it's a little bit different decision than at
Totally.
86. It's just like, okay, let's get
Yeah.
things done. You got to
Right.
think about what it's like and what you can do that way. Okay.
Okay. That itching and stuff is not contagious, is it?
Nope. Just drive you nuts, probably.
It certainly does.
Okay.
She's concerned about her boyfriend.
I am sexually active.
Okay. Yeah, so that's not going to be something that he is going to get, but certainly the condition of the tissues is going to make things a little more uncomfortable for you.
Yes, it does. And so I've just decided to put it on hold until I find out.
Well, let me
what's going on with
grab
me.
something else real quick for you. I'll be right back.
Okay. Beginning.
Mm-hmm.
But gosh, it looked like the bottom of a goblet. And I'm thinking, there's no way I can get that up there.
Well, it's not. They have them different sizes, and there's fittings for them. But my thing has always been, I just can't imagine that it's that comfortable wearing it.
Me either.
Because it springs open, and because what it does is you kind of bend it and put it in there, and when you let go of it, it kind of opens up to hold
Hers
everything
didn't.
up. And if the tissue's already kind of dry and irritated, I can't imagine that would feel necessarily that great.
Then
But-
getting it back out would be another problem.
Yeah.
And
'cause
you have to take them out frequently to clean them, I
Yeah,
guess.
Yeah.
But hers was a stable thing, like, I'm not kidding. It looked like the bottom of a goblet.
Yeah.
And I'm thinking, there's no way I could get that up there, even though
Right.
I've had this girl come off that chute.
Okay. Okay.
Yes.